this is about 2.5 hours after an L5 stroke S1 discectomy, huge disc, very large, and we recorded you just before the operation.
Yeah.
So first of all, I just want to say, how's your posture?
Well, it's good I'm standing without bending over. Like before, I was like crunched over like
Crunched
a lady,
over.
Yeah.
Yeah, that leg was not being able
Like
to.
this, yeah.
Yeah. Okay. And is there much pain in your back at the moment?
Not in my back, no.
Yeah.
There isn't, no.
Any pain shooting down that leg that you had?
No, it just feels more numb.
Numb.
Yeah, numb really, yeah.
Yeah. So remember, there's some anaesthetic there. We've just taken the pressure off that nerve.
Yeah.
So can I see you stand on your tiptoes?
Yeah. Am I allowed to touch
You can, yes, yes. That's good. Fantastic. And let me see you have a walk. Good. And you can look ahead. Okay, brilliant. And that's it. Can you stand on one leg? And the other one? That's a test.
Whoa, it
Yeah.
feels a bit wobbly.
Yeah, good. Not bad at all.
Yeah.
You know,
Great.
literally, as a day surgery for such a large disc prolapse, superb.